Imagine this. You undergo a critical, life-saving cancer surgery only to wake up facing a brand new, unexpected challenge. Well, today we're going to take you right inside the operating room to understand a pretty rare complication and the incredible microsurgical skill it takes to fix it. Okay, let's get right into it.
So how can a procedure that's meant to save your life also cause a really debilitating injury? That's the exact puzzle we're going to unpack today. We're zeroing in on that moment when surgeons have to suddenly shift gears, from removing cancer to performing a super delicate, high-stakes repair.
All right, so this whole story kicks off with a procedure called a pelvic lymph node dissection, or PLND for short. It's a really common and vital part of treating many gynecological cancers like endometrial or cervical cancer. The goal here is actually pretty straightforward. Surgeons go in and carefully remove lymph nodes from this one specific spot in the pelvis. It's called the obturator fossa. You can think of these nodes like tiny filters, and checking them is absolutely crucial to see if any cancer cells have started to spread around the body.
But here's the catch. While PLND is a routine surgery, that area is crowded with all sorts of vital stuff. And in about 0.2% to 5.7% of these cases, a really important nerve that runs right through there can get accidentally injured. Now that might sound like a tiny percentage, but when it happens, the consequences are immediate. So what is this nerve that's right in the line of fire? It's called the obturator nerve, and trust me, it's a huge player in how we control our legs.
Think of the obturator nerve as a long, essential electrical cable. It starts way up in your lower back, travels all the way down through the pelvis, passing right through that obturator fossa we just talked about, and then it ends in your inner thigh.
And its job? Oh, it's crucial. It controls the muscles that let you bring your leg inward toward the center of your body. You know, like when you squeeze your knees together? Yep, that's the obturator nerve at work. It also gives you feeling in your inner thigh and helps keep your hip and knee joints stable. So to put it simply, without this nerve, basic things like walking and just keeping your balance get really, really tough. And that brings us to the heart of the problem. What happens when, smack in the middle of a complex cancer surgery, this nerve gets accidentally cut or what doctors call transected?
Wow, and this image right here, it shows you the challenge perfectly. This is literally what the surgeons see during a robot-assisted surgery. You can see it clear as day. The two severed ends of the nerve, the connection is totally gone.
For the patient, the effects are immediate, and they're serious. They lose the ability to move their leg inward properly, which makes walking super difficult. They can get sharp pain in their groin and also that weird numb or pins and needles tingling feeling. It's a major problem that has to be fixed right then and there.
But this is where the story takes an incredible turn. This is where amazing surgical skill comes into play. The focus of the entire operation instantly switches from removing cancer to a super precise microsurgical repair mission.
And just look at this. On the left, you've got the severed nerve, and on the right, the nerve after the repair. Using these incredibly precise instruments, surgeons have meticulously stitched the two ends back together. It's just a remarkable piece of work. So how do they even do that?
Well, the go-to technique is called a primary end-to-end anastomosis. It basically boils down to 3 key steps. First, you identify the 2 clean ends of the nerve. Second, you line them up perfectly, making sure there's no tension pulling them apart. And third, you stitch that delicate, protective outer layer of the nerve back together.
And we are not talking about your everyday stitches here, not even close. To give you some perspective, surgeons are using sutures that are thinner than a single human hair. They're maneuvering these tiny threads with robotic instruments to get the most precise connection you can possibly imagine. Now, you might be wondering, what if the gap is too big? What if you just can't bring the two ends together? Well, surgeons have a plan B for that. It's called a nerve graft. They'll actually take a tiny piece of a less important nerve, like one from the lower leg, and use it like a bridge to connect the two ends of the main nerve.
Okay, so the repair itself is incredible, but the real question is, does it work? Let's take a look at what the patient's journey looks like after the surgery is all done.
And as you can see, the road to recovery is really different for every single patient. The results are usually good, but the timeline can vary a lot. I mean, look at this. One patient who got the direct repair was fully recovered in just 1 month, but another was still getting better 7 months later. And for a patient who needed that nerve graft, it took about 6 months to get their full motor power back. It just goes to show you, recovery is definitely a process, not a single event.
So the main takeaway here is that even though success isn't 100% guaranteed, the outlook for most patients is actually really positive. With a lot of dedicated physiotherapy to help retrain those muscles and nerves, a lot of patients see big improvements within just 3 to 6 months.
So after diving deep into this rare surgical problem and its amazing solution, what's the bottom line?
I think the authors of the study really summed it up perfectly. Even though this injury is super serious, the outcome after a quick and skillful repair is overwhelmingly positive. Most patients can get back to their lives without any major lasting problems.
All right, so let's just boil it all down to the key points to remember. First, this nerve injury is rare, but it's a serious risk. Second, spotting it and fixing it immediately is everything. Third, these modern microsurgery techniques are fantastic at restoring function. And finally, recovery times can be all over the map, but for most people, the outlook is really, really good.
And that kind of leaves us with one last big thought. This kind of super delicate nerve repair, often done with robots, is really the cutting edge of surgery. It just makes you wonder, as our technology keeps getting better and better, what other repairs that seem impossible today might become totally routine tomorrow?